Hey guys, Aaron Farmer here with mysugarfreejourney.com. It is time for day 21 of our 28-day challenge. So we are in the home stretch. We only got 1 week to go. So today what we're going to talk about is type 3 diabetes, which is a type of diabetes you probably have never heard of. So we're going to look at it today. You may have heard me say many times throughout this 28-day journey that more and more evidence is mounting that Alzheimer's and other dementia-type diseases, brain diseases, are basically type 3 diabetes. In other words, the same root causes that cause type 2 diabetes are causing mental problems as well. It's important to note before we continue on that diabetes doesn't cause dementia. Like, there's not a one-to-one connection there. But it's just that both issues spring from the same well of causes. So both type 2 and type 3 diabetes, dementia, are caused by the same types of things going on in your body. They both come from foods that force the body to create new metabolic pathways that are harmful to the body. In the case of Alzheimer's, the body's response to chronically high levels of insulin is to create plaques in the brain that essentially take over and replace brain cells. It's worth noting that the obese are at a much higher risk of impaired brain function, and diabetics are twice as likely to develop Alzheimer's. New estimates state that Alzheimer's will affect 100 million people by the year 2050. That is a crippling number that could bankrupt our healthcare system and our entire nation if something isn't done. And that doesn't include people without diabetes. That doesn't include people with diabetes who don't contract dementia. So that's a whole other subset of people that are going to be taxing our healthcare system as they get older. This is a critical issue. This is probably the most important issue that's going to be facing our nation in the next couple decades. And that's how important it is. So new research indicates that having dementia means that throughout your life you probably had one or more of the following risk factors. Number one, you lived with high chronic blood sugar levels, even in the absence of diabetes. So even if you never developed full-blown diabetes, you had high blood sugar throughout your life. Number two, you ate too many carbohydrates through your life. Number three, you opted for a low-fat diet that minimized cholesterol. Or number three, you had an undiagnosed sensitivity to gluten, the protein that's found in wheat, rye, and barley. So if you had any of those four, or even all four of those conditions in your life, you were at a much higher had a higher risk of Alzheimer's or other mental issues, other dementia and that kind of thing. And you know what? Most Americans, that's what they do. They eat more carbs because they've been told to eat whole grains. They eat low fat because we've always been told to limit our fat. And up to 20 to 25% of us probably have an undiagnosed sensitivity to gluten, and it's never diagnosed because usually the only time that we diagnose issues with gluten is if it's affecting our GI tract. But there are other things that can go wrong with you that aren't as easy to pin down, that require a specific test to test specifically for gluten sensitivity, and most of us never have that test. So when talking about gluten, most people think that people with celiac disease are the only ones that need to worry about it. This is because gluten is only thought of in terms of gastrointestinal health, but new research indicates that gluten also has an effect on the brain, and that we're all sensitive to gluten to a greater or lesser degree. So you might have a low sensitivity, you might have a higher sensitivity, but gluten affects all of us in some way. Dr. Perlmutter, he's the president of the Perlmutter Health Institute, says, this is a quote, "Many of my patients reach me once they have, quote, tried everything and have been to scores of other doctors in search of help. Whether it's headaches and migraines, Tourette's syndrome, seizures, insomnia, anxiety, ADHD, depression, or just some odd set of neurological symptoms with no definite label, one of the first things I do is to prescribe the total elimination of gluten from their diets, and the results continue to astound me." Researchers have known that the cornerstone of all degenerative diseases, including mental conditions, is inflammation. What we've only recently been figuring out is what exactly is causing the inflammation. It turns out it was gluten, specifically gluten and carbs in general, that are causing inflammation throughout our body. Inflammation is supposed to be something that only shows up for a short amount of time in response to an issue, helps the body deal with that issue, and then goes away. For instance, if you get a mosquito bite, it gets inflamed, your body releases histamines and all the other things it needs to release in order to heal that spot on your body, and then the inflammation goes away. That's how inflammation is supposed to work. However, when we constantly introduce gluten into our system, we are keeping our bodies inflamed for a long period of time, causing long-term damage. In fact, I've looked at old pictures of me back when I was eating grains, and my hands were so fat. I mean, they were just thick, sausage fingers. And it wasn't the extra weight that I was carrying; it was the inflammation. I just had inflammation. If you can look now, you can see my wedding ring. I've had to put a spacer on it as so that it doesn't fall off. Now some of that's because I've lost 140 pounds, but a lot of that's just because the inflammation has gone down and my fingers. I used to have what?
You used to have pain in your hands.
Yeah. Oh yeah. I used to have pain in my hands and pain in my knees. But once I stopped eating grains, all that inflammation went away. I no longer have pains in my hand. I no longer have pain in my knees. I just do not have the pain anymore. And that's what getting rid of the inflammation in your body can do for you. We already deal with inflammation in our bodies as a way to handle certain diseases. For instance, if you have arthritis, arthritis is caused by inflammation in the joints. We handle that with aspirin, which is an anti-inflammatory. Another one is asthma. Asthma is handled by anti-inflammatory inhalers. And it just reduces the swelling in your lungs and helps you breathe better. New evidence shows that taking an aspirin for a heart condition works, not because it thinned out the blood, which is what we previously thought, but because it actually reduces swelling in the blood vessels. So there are a host of issues that can be dealt with just by reducing the amount of swelling in your body. But the idea that inflammation causes mental disorders has only recently begun to catch on. But in fact, studies dating back as far as the 1990s show that people who have taken a non-steroidal anti-inflammatory medication such as Advil, which is ibuprofen, or Aleve, which is naproxen, for 2 or more years have a more than 40% reduced risk for Alzheimer's or Parkinson's disease. And it's just because they controlled that swelling in their body, that inflammation in their body for a long period of time. At the same time, other studies have clearly shown dramatic elevations of cytokines. Cytokines are the cellular mediators of inflammation. It's what we measure in our blood to figure out how inflamed we are. But we've shown dramatic elevation of cytokines in the brains of individuals suffering from these and other degenerative brain disorders. And today, new imaging technology has finally allowed us to see cells actively involved in producing inflammatory cytokines in the brains of Alzheimer's patients. So we've actually seen, the inflammation doing damage to the brain of an Alzheimer's patient. So inflammation is a very, very big deal. It is the it's the one thing that if you can get a handle on, you're gonna make yourself far, far healthier in the long run. And the way that you do that right now, the best way that we found out how to do that is just don't eat gluten, because gluten is a natural inflammatory agent. Once you get rid of the gluten, you'll see the inflammation in your body go down. You'll start to feel better, and a lot of chronic diseases that you might be suffering with will go away, or at least lessen. And we've seen this in many cases. Of course, you don't want to do anything without some input from your doctor. If you're under a doctor's care, you want to discuss everything like that with them. I'm not a doctor. I want to make sure that's very clear. But I've read what many other doctors are saying, and the ones that are on the leading front edge of this research are all coming back with the same story. It's the gluten, it's the grains that are causing a lot of the inflammation and problems. So if you'll cut out the sugar, if you'll cut out the grains, you'll be really far into improving your health and into losing weight and to reducing the amount of chronic disease or the amount of pain that you have in your body. So I would encourage you to do that. I appreciate you watching. This is Aaron with My Sugar-Free Journey. Please remember to subscribe to the YouTube channel. Make sure you never miss a video. And come join us over at the 28-Day Challenge Facebook group. We'd love to have you over there. If you are watching this on the computer, there's a link to the post underneath the video. If you're watching this on mobile, up in the top right-hand corner, there's a link. Click up there, and it'll take you over to the same post. Appreciate you watching. We will talk to you tomorrow. Bye-bye.